If you are taking a blood pressure medication right now, Losartan, Valsartan, Amlodipine, Metoprolol, or any combination of these, I need you to stop and watch this video carefully, all the way through, not because your medication is wrong, not because I want you to stop taking it, but because after more than 40 years of prescribing these exact drugs to thousands of patients, I can tell you with absolute certainty, most people on blood pressure medication are making critical mistakes that are quietly making the medication less effective, causing unnecessary side effects, and in some cases, silently putting their heart, their kidneys, and their brain at serious risk. And the frightening part? Their doctors never told them. Supplement. Not because they don't care, but because there simply isn't enough time in a 10-minute office visit to cover everything you need to know. Today, I am going to cover it all. So stay with me. Supplement. Let me set the stage for you, because context matters here. High blood pressure, what doctors call hypertension, is one of the most aggressively medicated conditions in modern medicine, and for good reason. Uncontrolled hypertension is the single leading modifiable risk factor for stroke, heart failure, kidney disease, and heart attack. The stakes are real. The danger is real. Medication saves lives. I have seen that with my own eyes. But here is what I have also seen with my own eyes across 4 decades of clinical practice. Medication that is prescribed without proper education is only half a treatment. Patients who don't understand what their medication is doing, what it's interacting with, what it needs to work properly, and what warning signs to watch for, those patients often end up in my office, or worse, in the emergency room, wondering why things went wrong when they were doing everything right. There are 4 medications I want to address specifically today, because together they represent the vast majority of blood pressure prescriptions written in this country. Losartan and Valsartan both belong to a class called ARBs, or angiotensin receptor blockers. Amlodipine, a calcium channel blocker, and Metoprolol, a beta blocker. Millions upon millions of people take one or more of these every single day. Today, I am going to walk you through what you absolutely must know about each one, what they do, what silently interferes with them, what side effects most patients never connect to their medication, and what you can do to make them work far more effectively and far more safely for your body. This is the conversation your doctor wishes they had more time to have with you. What you must know about Losartan and Valsartan, ARBs. Let's start with Losartan and Valsartan, because I see more confusion around these two than almost any other blood pressure drug class. Both of these medications work by blocking a chemical in your body called angiotensin II. Think of angiotensin II as a powerful signal that tells your blood vessels to squeeze tight. When your blood vessels squeeze, your pressure goes up. Losartan and Valsartan essentially block that signal. The blood vessels relax, pressure comes down. That is the simplified version, and it's accurate enough for what we need to discuss today. Supplement, they also have a critically important secondary function that most patients are never told about. They are profoundly protective of the kidneys. For patients with diabetes or early kidney disease or protein in their urine, these medications are often the first choice specifically because they shield the kidney tissue from the damaging effects of high pressure over time. Now, here is what I've seen go wrong again and again. I had a patient I'll call Gerald, a 68-year-old retired firefighter, big guy, proud guy, not the type to read labels. He had been on Losartan for about 2 years. His blood pressure was somewhat controlled, but never quite where we wanted it. We kept having to increase his dose. He kept reporting fatigue and occasional muscle cramps. One day, almost by accident during a longer appointment, I asked him about his diet in detail, supplement, and Gerald told me he had been drinking about 2 glasses of fresh pressed orange juice every morning and eating bananas and avocado regularly because he'd heard they were heart healthy. He was right that they're heart healthy. He was wrong to combine them so liberally with losartan. Here is what most people on ARBs are never told. These medications raise the level of potassium in your blood. That is a known, documented pharmacological effect. And foods that are very high in potassium, bananas, avocados, oranges, potatoes, certain salt substitutes, can push that potassium level too high when combined with these medications. Elevated potassium in the blood, a condition called hyperkalemia, is not something you feel until it becomes dangerous. And when it becomes dangerous, it can affect your heart rhythm in ways that are life-threatening. Gerald's muscle cramps were an early warning signal that neither he nor his previous doctor had connected. I ran labs. His potassium was elevated. We adjusted his diet. Within 6 weeks, his cramps were gone, his blood pressure was better controlled, and we were actually able to slightly reduce his dose. This is not me telling you to avoid potassium-rich foods. These foods are excellent for cardiovascular health in general. This is me telling you if you are on Losartan or Valsartan, if your potassium levels checked regularly, discuss your diet specifically with your doctor to never take potassium supplements unless your physician has explicitly reviewed your medication list and approved it. There is a second thing about ARBs that I want to address. And this one is for the patients who decide on their own to stop taking them because they feel fine. I have seen this mistake destroy lives. High blood pressure returns quickly, sometimes with a rebound effect when these medications are stopped abruptly, and it returns silently. You will not feel your blood pressure spike. It will simply feel fine, right up until the moment you don't. Please, if you want to reduce or discontinue your medication, have that conversation with your doctor first. Plan it together. Never stop cold. What you must know about amlodipine calcium channel blocker. Now let's talk about amlodipine. And I want to start here with what I consider one of the most overlooked drug interactions in all of cardiovascular medicine. Amlodipine works by blocking calcium channels in the walls of your blood vessels. Calcium causes muscle cells to contract. When you block calcium from entering those cells, the blood vessel walls relax and widen. Blood flows more freely. Pressure drops. It's an elegant mechanism and it works very well. Amlodipine is also one of the most commonly prescribed medications for angina, chest pain caused by narrowed arteries, because it improves blood flow to the heart muscle itself. Here is what I need you to understand about amlodipine and something that is sitting in millions of American kitchens right now: grapefruit. I am completely serious. Supplement, and I say this not to be dramatic, but because I have seen a patient end up in the emergency room because of this exact interaction. Supplement, a lovely 72-year-old woman, I'll call her Patricia, who had been stable on amlodipine for 3 years. She started a new heart-healthy diet that included grapefruit every morning. Within 3 weeks, she was dizzy, her ankles were severely swollen, her heart was racing, and her blood pressure was swinging wildly. Here is what happened biochemically. It's grapefruit, and grapefruit juice contains compounds called furanocoumarins. These compounds block an enzyme in your intestine and liver that is responsible for breaking down amlodipine in your system. When that enzyme is blocked, your body cannot metabolize the drug normally. The medication accumulates. Blood levels rise far above what was intended. And you effectively end up with a massive overdose of amlodipine without taking a single extra pill. The result is a dramatic and dangerous drop in blood pressure, combined with other side effects, including severe ankle swelling, heart palpitations, flushing, and extreme dizziness. In elderly patients, that kind of blood pressure swing dramatically increases the risk of dangerous falls. Patricia had not been warned. She had no idea. And she is not alone. This is one of the most underreported drug-food interactions in medicine because patients assume food cannot interact with medication the way other drugs can. That assumption is wrong. If you are on amlodipine, eliminate grapefruit and grapefruit juice entirely. This is non-negotiable. There is no safe amount. Interaction is too unpredictable and too potentially serious. Now, the second critical thing about amlodipine, and this is something I discuss with every patient I prescribe it to. Ankle swelling, peripheral edema. This is the most common side effect of calcium channel blockers, and it affects a significant percentage of people, particularly women over 60. Here is the mistake I see constantly. The patient develops swollen ankles. They don't connect it to their medication. They Google swollen ankles and become alarmed about heart failure. They go to an urgent care, and the urgent care physician, without knowing their full medication history, prescribes a diuretic water pill on top of everything else. Now they're on a drug to treat the side effect of another drug without addressing the source. If you develop new ankle swelling after starting amlodipine, tell your prescribing doctor immediately. In many cases, switching to a different medication in the same class or adjusting the dose resolves the swelling completely. You do not automatically need to add more medication. What you must know about metoprolol, beta blocker, and now we come to metoprolol supplement. And I want to spend a little extra time here because metoprolol is a medication that is simultaneously one of the most valuable tools in cardiovascular medicine and one of the most commonly misunderstood by patients. Metoprolol is a beta blocker. It works by blocking the effect of adrenaline, epinephrine, on your heart. When adrenaline is blocked, your heart beats more slowly and with less force. So blood pressure comes down. The heart's workload is reduced. For patients with heart failure, certain arrhythmias, and angina, metoprolol is genuinely life-saving. But for blood pressure alone, this is where I see confusion and frustration arise most often. Metoprolol makes people feel different. That is simply the truth. It slows your heart rate. It can reduce your exercise capacity. It can make you feel more tired, more sluggish, less sharp than usual. Some patients describe a kind of emotional flatness, a dampening of their energy and mood. In older patients, it can worsen symptoms of depression. I'll tell you about a patient I'll call Thomas. 65-year-old former marathon runner, yes, a real runner, still active, who came to me after being started on metoprolol by a cardiologist following a mild hypertension diagnosis combined with a slightly irregular heart rhythm. His blood pressure justified the prescription. The arrhythmia justified the prescription. But nobody had explained to Thomas what to expect. Within 2 months, Thomas had essentially stopped exercising, not because his joints hurt, not because he was unwell, but because every time he tried to run or even walk briskly, his heart felt like it simply would not respond. He couldn't get his heart rate up. He felt leaden, heavy supplement, like someone had placed a wet blanket over his body. He came to me frustrated and frightened. He thought he was getting old faster than normal. He had no idea his medication was responsible. This is critical information. Metoprolol lowers your maximum achievable heart rate. That is not a malfunction, it is the mechanism. But it means your perceived exertion during exercise will feel much higher than it actually is. If you have always used heart rate as a guide for exercise intensity, you must stop doing that on metoprolol. Your target numbers no longer apply. You exercise by feel, by breath, not by rate. I worked with Thomas to adjust his exercise protocols, and we had a longer conversation with his cardiologist about whether the metoprolol dose could be optimized. It could, and Thomas started running again, not at marathon pace, but running, living now. The single most dangerous metoprolol mistake I have seen in 40 years. And I want you to hear this clearly. Do not stop metoprolol abruptly under any circumstances. I cannot stress this enough. When you take metoprolol consistently, your heart actually adapts. It's the beta receptors on your heart cells, the very receptors the drug is blocking, become more numerous and more sensitive over time. This is your body's way of compensating. When you abruptly remove the drug, those supersensitive receptors are suddenly flooded with your own adrenaline. The result can be a dangerous rebound surge in heart rate and blood pressure. In vulnerable patients, this can trigger a heart attack or a serious cardiac arrhythmia. Most people don't realize this until it's too late. A patient decides to stop because they don't like the side effects. They feel fine for a day or two. Then their heart starts pounding, their blood pressure spikes, and they end up in the emergency room. If you want to discontinue metoprolol, the dose must be tapered slowly under direct physician supervision. This is not optional. This is the medical standard for a reason. It's the mistakes that cut across all 4 medications. Now I want to step back and talk about mistakes that apply to all of these medications, because these are the patterns I see week in and week out that quietly undermine treatment. The first and most pervasive mistake I see is what I call selective compliance. Taking your blood pressure medication only when you remember, only on the days you feel stressed, skipping weekends because you feel fine. I want to be absolutely direct with you about this. Blood pressure medication only works when it maintains a consistent level in your bloodstream. Every dose you skip is a window, sometimes a multi-hour window, during which your blood pressure can climb back to dangerous levels. You don't feel it. You have no idea it's happening, but your arteries feel it. Your heart feels it. Your kidneys feel it. Cumulative damage builds over months and years of inconsistent treatment. Take your medication at the same time every single day. Set an alarm if you need to. Keep your pills visible. Make it as automatic as brushing your teeth. Second mistake, and this one genuinely alarms me, is combining these medications with common over-the-counter drugs without checking first. Non-steroidal anti-inflammatory medications, NSAIDs, ibuprofen, naproxen, common pain relievers that millions of people use casually for headaches, back pain, supplement, and arthritis can significantly blunt the effectiveness of ARBs, calcium channel blockers, and beta blockers while simultaneously raising blood pressure and stressing the kidneys. I have seen patients spend months wondering why their blood pressure was poorly controlled, only to discover they were taking ibuprofen for knee pain every single day. They didn't mention it to their doctor because they didn't think an over-the-counter drug counted as real medicine. It absolutely does. If you are on any blood pressure medication and you need regular pain management, please regular pain management. Please bring that conversation to your physician. There are safer alternatives. Acetaminophen, for example, does not carry the same blood pressure concerns for most patients. The third universal mistake is alcohol. Even moderate alcohol consumption elevates blood pressure and directly interacts with blood pressure medications in ways that are unpredictable and sometimes dangerous. Alcohol combined with amlodipine or metoprolol in particular can produce excessive blood pressure drops that cause falls and fainting in older adults. This is not me telling you that you can never have a glass of wine. This is me telling you to have an honest, explicit conversation with your doctor about alcohol and not to assume that one glass is automatically safe in your specific situation. I want to take a moment and step away from the medical facts as I think about my patients not just as cases, but as people, as husbands and wives, as grandparents, as people who have worked hard their entire lives and deserve to enjoy what they have built. And I think about the conversations I've had in rooms that were too quiet. Supplement with families who didn't understand what happened, with patients who told me, and I will never forget these words, I just didn't think it was that important. High blood pressure medication is not a nuisance. It is not a sign of weakness. It is not something to be embarrassed about or to manage casually. It is a powerful pharmacological intervention that is keeping your cardiovascular system from reaching a point of catastrophic failure, and it deserves your full respect and attention. If you are over 60 and you are managing blood pressure medication, you are doing something right. You are being proactive. You are taking your health seriously. And I want to help you do it as effectively and as safely as possible, because the goal is not just to live longer. The goal is to live well, independently, vibrantly, present for the people who need you most. What I've shared today isn't meant to frighten you. It's meant to empower you. Walk into your next doctor's appointment with these questions. Ask about your potassium levels. Ask about your alcohol interaction. Ask about your exercise tolerance on metoprolol. Ask what stopping your medication would look like if that ever became appropriate. You deserve those answers. And your doctor, I promise you, will respect you more for asking. Let me give you the most important takeaways from everything we've covered. If you are on Losartan or Valsartan, watch your potassium intake, get your labs checked regularly, and never stop the medication abruptly without medical supervision. If you are on Amlodipine, eliminate grapefruit entirely. Report new ankle swelling to your doctor immediately. Do not simply accept a new prescription to cover a medication side effect without exploring alternatives. If you are on metoprolol, adjust your expectations and approach to exercise. Watch for mood or energy changes, and above all, never, under any circumstances, stop this medication cold turkey. Taper only. Always under supervision. For all 4 medications, take them consistently at the same time every day. Declare every over-the-counter drug and supplement to your physician and have an honest conversation about alcohol. And finally, these medications work best as one part of a larger strategy. The breathing walks, the isometric exercises, the slow flowing movement we have discussed in previous videos, the right dietary choices, medication and lifestyle together produce results that medication alone never can. Now, if what you heard today gave you something valuable, if it filled in a gap that your doctor hasn't had the time to fill, if it made you feel more informed, more empowered, more in control of your own health, then I have one simple request. Hit that like button right now. And subscribe to Longevity Lane because I put out new content every week on exactly these kinds of topics, the things that matter enormously to your long-term health, but that often fall through the cracks of a rushed medical system. Leave me a comment below. Tell me which medication you are taking. Tell me if you've experienced any of the side effects or interactions we talked about today. Your experience matters, and it might help someone else watching this video recognize something they missed. And please share this video. Share it with someone you know who is managing blood pressure. Share it with a parent, a sibling, a friend, because your health depends on this information, and so does theirs. I'll close with this. Medicine, at its best, is a partnership. Your physician brings the knowledge, the training, the tools, but you bring something irreplaceable, the detailed, honest account of your daily life, what you eat, what you take, how you sleep, how you feel. Without that information, even the best doctor is working in the dark. You are not a passive recipient of your health care. You are an active participant. And that participation, asking the right questions, making the right lifestyle choices, understanding the medications in your own cabinet, that participation is where the difference between a good outcome and a great one is made. Losartan, Valsartan, Amlodipine, Metoprolol, these are powerful, life-protecting medications. Respect them, understand them, use them wisely. This is Dr. Mandell reminding you that knowledge is the most powerful medicine of all, and you now have more of it than you did 20 minutes ago. Use it. Stay well, and I will see you in the next video. If you care about your health, want to understand what's silently harming your body, and are ready to learn the truth about living a longer, stronger, and healthier life, subscribe to Longevity Lane with Dr. Mandell. Here, we reveal the health truths most people discover only when it's already too late.